Let's then move on to the first of the papers that's being presented to us this morning, which is on our proposals for organisational design, and I'm going to ask Bill McCarthy to introduce the papers to us.
Thank you, Chairman. This paper represents quite a significant step in the evolution of the board authorities' plans for the future commissioning board. It sets out within the financial constraints for the new system our proposals for how best we can achieve those aims of improving outcomes for all our patients and communities across the country, for ensuring there's clinical leadership at all levels of the new NHS, for engaging very openly with patients and the public in the way we make decisions, in fostering innovation and creativity in everything we do, and in having a real focus on equality and tackling health inequalities. So those are the themes around which we've built our organisational proposals. We set this out in a fair amount of detail across the 9 proposed directorates, because this will be quite an important platform to enable us to start moving forward with our recruitment strategy in the coming months. This is not, as I think you said at the start, Chairman, without risk. The endeavour is a significant one. The commissioning board is part of an overall commissioning system which will operate within running costs which are about a third lower than they are currently, and within that the commissioning board is taking, if you like, a tougher stance. Our own running costs will be broadly 50% in real terms by 2014-15, lower than those of organisations currently discharging the responsibilities that we shall have. I think that's been done very deliberately and with the intent of ensuring that CCGs, both in their direct employment and through commissioning support units, have got the right resource at the front line. Of course, that means that in creating our organisation, we'll have to be really quite innovative in the way we establish our processes, and at the heart of the proposals here is a way of matrix working that ensures there's a real degree of collaboration across all the directorates, so that there's a simplicity of approach and a simplicity in the way we connect to the service itself, but also that those efficiencies through doing things once, through having common processes right the way through the organisation, are established right from the start. Just a couple of points I might highlight, if I may, Chairman, since the papers were published. We've had some good discussions with representatives of patient groups around specialised commissioning, and we're confident that the proposals before you satisfy the agreements to have a really prominent focus on the resource that the Commission Board will need to have to ensure that those specialised services, about 10 billion of our budget, when we come to be spending it, is given the right attention and given the right focus on outcomes. As we recruit to the director posts, there will be a director who will take a lead responsibility around specialised service commissioning, so there will be a good point of contact for the various groups who have got those interests. The other matter that I don't think comes out of the papers as explicitly as it might, I think, is our commitment to research into the future. We have that research and innovation not only as one of the duties that we'll take on as a commissioning board, but as one of the values that we want to be right the way throughout the organisation. We see, I think, a particular role for the medical and the nursing directors in giving leadership around clinically based research and some very important relationships with the Health Research Agency as it is established. We also see through our innovation function some very important connections, not just to encouraging research but to spreading and implementing in practice. And within, I think, the quite important analytical resource that we're providing for, we see a post of chief economist, chief analyst, which we will want to have a real focus on understanding research about health systems and how best they behave, so that we can be a really important voice in the way our health service and the system within which it works develops in the coming years. So perhaps that's not something that came through as clearly as it might in the presentation, but just to emphasise it is something very important to the focus of the organisation. So if the board is content following discussion, these proposals then would form the platform for our organisational development and our recruitment strategy over the coming months, dependent of course on the passage of the bill through Parliament. I think it's probably all I had to say in introduction, Chairman.
Well, thank you very much, Bill, and thank you for a clear and concise paper. We all, I think, understand that this is a general framework within which the enormous amount of work to be undertaken to fill in the gaps. But let me ask my colleagues on the board if they have some questions to direct to Bill before we go into a more general discussion. Kieran?
Just on this, it's the risk question. Is this a capacity rather than a structure which is designed based on what we're being asked to do, or is it one which is the one we can afford because it's the bucket of money we're being given? And then maybe a follow-on is we've been quite specific in some places around the number of FTEs in different boxes. It's very hard to get that right, certainly uniformly. What happens if somebody says, well, with the best will in the world, I can't do what you're asking me to do with 24 people, I need more? What's the flexibility around saying, actually, we need to do it in a different way?
Yep. I think we're working within the resource envelope that the government has decided is the right one for the commissioning system into the future. The caveat to that is that this is a resource envelope that will be our recurrent resourcing on running costs from 2014-15. So there's a period that runs up to that. And I think that's connected to your second question. We've had a lot of discussion with the group of senior officials who are leading the design of the particular components, and as best they can anticipate, and in the best way we could get to through those discussions, through different bits of work with colleagues who are currently out in PCTs and SHAs. This is our best view now for the sort of disposition of resource, together with the different ways of working which will enable us to achieve our objectives. But we recognise this is pretty early, so you'll see from the figures that we've built in quite a significant level of contingency at 60 million. Plus we've got in the first year of our operation, 2013-14, additional non-recurrent resource. So as directors are appointed, as we get into the detail of the design, as the processes and methodologies are flushed out, if it becomes clear that we need a bit more resource in particular areas, for example in some of the local offices or in different of the central departments, we've got that flexibility to play in, and we've got a process with those directors to achieve it. But I'm not encouraging that, I have to say.
And how will we pick up that something's going wrong? Because everybody will do their best. Some people will pick up and say, yeah, you can have a bit more. Some people will carry on, try very hard. And the risk is high.
I'm assuming that as a board you're going to want very regular progress reports. What we've tried to do in the paper is give you a sense in those last couple of slides of where we think the greatest risks are, so that you're equipped to to keep prodding, to looking for the evidence about how we're mitigating those risks and how we're managing it through in practice. So I think you'll have material which will be very open with to enable you to form some judgments. But I'm expecting the implementation of these proposals to be right at the heart of each of the board meetings.
Ed, before you say anything, just to warn you, there's quite a lot of ambient noise coming eccentrically from the audio feed. Can you hear us all right still?
I can certainly hear you fine, yes.
And we can hear you fine.
I think the technicians are trying to sort it out.
I think it is one. Maybe he could put his.
No, I
It's the volume on it.
very supportive of this, and I think the point that Kieran's made and Bill's responded to is important, that we not only have a full view of the risks of things slipping, but we also recognise that a lot of it is about changing working practices, not just within our own ambit, but within the whole ecosystem of the health service. And you know, we will need some early indicators and observations of how those working practices are changing beyond those which we can directly influence, because that will give rise to a different resource envelope within the commissioning board itself. And I think it reinforces the importance of organisational development, both within our commissioning board in changing those ways of working and in the way in which we communicate with the rest of the ecosystem of the health service. But I'm very supportive of this paper.
I mean, just a couple of things, particularly in relation to what Kieran was saying. I think the thing we need to be really careful about is where the pull in the system is around all of this. And traditionally the pull has been around the kind of functional or professional heads and leads. And I think a bigger issue for us is to make sure that not that the patient experience and insight team has got enough people, or that the nursing one or whatever. It'll be, I think, how we can corral the people around the 5 domains. So, you know, how will we make sure that we've got the right number of people working on mortality as a major issue? How we get the right number of people working on long-term conditions, or how we got the right people working on patient safety, which I think is a different set of principles from what, because you don't get the sense of that I don't think by reading this paper. You get the sense of what the whole time equivalents are for each of the individual heads, and I think that's for me an even more important one, to make sure how can we as a board test that actually people are organising themselves around those issues. I think it's going to be critical.
Can I ask one more question? What's the risk that we set it up with this, but then somebody comes along and say, now can you do this too? Within that same envelope.
Yeah, they're already queuing up to do that. I mean, it's undoubtedly going to be a tension for us, and we need to be pretty, well, hopefully we'll be very transparent about all of this, because if people ask us to do something, we'll look at it, see how we can do it, and we'll set out what we think we need to do it. 2 good examples of that, I think, are coming up on stream for us. One is public health, because the likelihood is that we're going to be asked to take on the responsibility of probably in the region of £2 billion worth of public health commissioning as part of the development of Public Health England. And in this environment here, we've built nothing in the running costs or the arrangements for how we're going to do that. And we're involved in negotiation, discussion with the department around all of that. And the other one is informatics. That's right. I think, again, which I think we need to kind of very clear about setting out what we can do and how much running costs we'll need to do it. Now, that's going to be a negotiation. I'm sure we'll not get everything we ever want and all the rest of it. But I think that transparency and that clarity is really important. And this is what I think this gives us the base to work from. I don't know if that's fair.
That's right. Yeah.
Good.
Bill.
Right, well, thank you. It seems to me, summing up, that, Bill, you have got very warm support from the board for the principles in the paper and in the larger document. Secondly, welcome what you say about research coming in. Thirdly, I think that the points raised both by Ed and by Kieran are vital as to how we see this as work in progress and how the relationship with the board is maintained, and how we are alerted to any significant changes in course or direction. And what David has just said about both public health commissioning and informatics, I think, are major items that we'll wish to keep a close eye on. But subject to those caveats, may we approve the 3 things we're asked to approve: the disposition of the commissioning board's running costs, the directorate structures and staffing, and the model of matrix working as the basis of further work. Right, thank you. Those items are approved.